My name is Anissa Mitchell, and you are with PND Alliance. Today, we're talking about Beyond Meds, assistive devices for sexual health and intimacy. So we're going to be diving into options available to you that are outside of medications to address your sexual health and intimacy, and symptoms such as erectile dysfunction, pelvic pain, decreased sensation, vaginal dryness, and more. We know this is a quality of life issue, probably doesn't get discussed often enough, and there are limited treatment options. And so today we're going to be learning about MV.Health's Urogyne devices that are available to you to help improve sexual health. This is a non-medication option. We feel at PMD Alliance how important it is for you guys to have the opportunity to have honest conversations about your challenges faced with living with certain symptoms with Parkinson's disease, and to provide you an awareness of all treatment options, whether that is medications and understanding them, technology that's available to you, or supportive devices such as you're going to hear about today. So we want to be a conduit to that information, and we're excited to bring this particular topic to you today. Our speaker is Soum Rakshit, who is the CEO and co-founder of MV.Health. He has a PhD in biomedical engineering with a focus on healthcare innovation. So he is going to be sharing some slides with you and discussing the different tools and options available to you and what they are addressing. So Soum, I'm excited to have you with us. I'm going to pass this over to you, and I will quickly just say, please feel free to drop your questions in the chat. We will have quite a bit of time at the end to go through questions. If you have a question and you're uncomfortable putting it in the common chat, you can feel free to direct message me. Anissa Mitchell is my name. You'll find me probably one of the first names at the top of your list. And you can ask those questions and I will ask it on your behalf. But I'm going to pass this over to you, Soum, and let you get started.
Thank you so much. Thank you for having me. Let me share my screen, get the document up, and then let me know when you can see it. Okay, great. Yeah. And you can hear me well. Yeah. Hang on. I think you'll be able to hear me better. Yeah, you can hear me really well. Okay, perfect. Thank you so much for the intro. So like Anissa said, the work we do is making devices that people can use at home for urology and gynecological healthcare. So anything from dryness, pain, erection, ejaculation, prostate health, all kinds of things in urology, gynecology, which would typically need therapy or medication or surgery. We try to solve with at-home care with small patient devices. So the reason we started in 2014, so 12 years ago, here at King's College, where I'm based in London. Our head of urology looked at the various ways we can solve urological and gynecological issues. And the reason was, and it is probably much bigger now than it is when we started, that 1 in 2 men suffer from erectile issues, erection issues due to psychological or physiological challenges. 1 in 3 women experience pain, dryness. And of course, a lot of this data would be underreported, which means it would be much more than what the stats show. The biggest challenge was that 2 in 3 of these people who do suffer from various sexual dysfunctions never seek treatment. And that could be because it's just not accessible. So for example, someone might have pelvic pain and the nearest PT could be in a different city. It could be because lack of awareness. Someone might have dryness because of menopause and they just don't know that there are solutions out there. Or, it could be stigma. Maybe they know that they should get their prostate exam, but they don't want to go and talk about it. So a whole host of reasons that a lot of people suffer in silence when it comes to sexual health, and they don't seek any specialist. So the solution that we thought of is if we could create devices that people can use at home, then we could overcome a lot of these barriers. And the
I'm
big,
sorry, I
sorry,
don't mean to interrupt
yes.
you.
Mhm.
I don't know if this is a problem for everyone, but your slide is jumping. I don't know if it's doing that on your end, but on this end, it seems to be bouncing.
Oh, let me stop sharing and share again. Yeah.
Okay. I just think that might be, I don't know, disorienting for other people.
Is it any better now?
Yes. If it jumps again, I'll let you know because it seemed fine
Hmm.
at first. So I don't know if it's a system thing with sharing or not, but I just wanted to make you
Hmm.
aware. Sorry to
Okay,
interrupt
cool.
you.
Yeah. No, no, no worries. Um, so the big challenge, and it has obviously been a challenge when we started, but it's become a bigger challenge, is the gap between how many specialists and clinicians there are. So, for example, there are less than 15,000 urologists in US, but there are um, probably 100 million people who need urological help for various things. And it could be a teenager with urogyne issues, or it could be someone in their 80s needing prostate help. And all of that falls under urology. And that's just one part of sexual health. You have OBGYN, pelvic floor, sex therapy, a whole host of things. But the gap has increased significantly because of awareness, which was one of the problems when we started, where there simply just wasn't enough knowledge about menopause, knowledge about prostate health. Now, thankfully, there has been a lot of work done by media, by celebrities, by doctors, by movies, So people now actually know about menopause, know about prostate cancer, know about pelvic health issues. So they are seeking solutions, but the number of doctors hasn't really changed. I mean, it would probably take at least 15 years to become a specialist. So that doesn't change quickly, and which has made the systemic gap much bigger. Um, and at the same time, there hasn't been many solutions. So surgical is one of the solutions, but often and should be the last option. So let's say hysterectomy or penile implants or prostatectomy. So whatever it is, the surgical solutions do exist and they are sometimes the best solution, but shouldn't normally be the first solution. Then there are on the other end consumer solutions, but unless they're scientifically proven, they're quite hard to know whether they'll work. So, for example, supplements can be good, but then they need to be targeted. It needs to be the right supplement for the right person. And also, it needs to come from a very reliable company. So, you know that you're getting exactly what it says is there. So, the key thing is if there are not enough clinicians, then we need to deliver at-home care. As an example, pelvic pain, if you can't go to a PT, um, if you can at least access telehealth, where you have a video call, the PT explains what you need to do, then they ship a device to you, you use it, you get the instructions, and then you have another consultation in a few months, then at least you have some solution. It's not the ideal solution. The ideal solution would definitely be going to see the PT, but in most cases, they just wouldn't have the time or the patient wouldn't have the access. So that's really where and just to, before we get into the solution, the scale of the problem is really big. And again, these numbers are the stats which are known. What definitely would be a subset of the actual numbers. So the and this is one of the biggest issues in sexual health is everyone has some sexual health issue once or more in their life. Whether it's um, a young woman having period pain, which then becomes severe pain, which is 1 in 3 that's reported. As they get older, they have menopause and dryness, which can, be due to atrophy, hormonal imbalance. And then, if they have some kind of surgery, the post-recovery or cancer, again, the post-recovery, and the same on the male side, even young men due to stress, due to um, just mainly psychogenic reasons, have erection issues, which again need some kind of support in order to overcome the psychogenic issues. Then, of course, as they get older, they might have pelvic health issues. Prostate obviously is a very big problem with aging, especially with enlarged prostate and then prostate pain, and maybe that lead to prostate cancer. However, there are simple things people can do to avoid that happening because these are not genetic in most cases. These are more lifestyle related, which means it can be prevented. Same with, say, for example, ejaculation dysfunction, which becomes a major issue if someone is trying to have a kid, and especially with nerve damage, which is quite common with diabetes, then it becomes very hard to ejaculate. So all of these issues are really common, as the numbers show, and which is why the need is huge in creating solutions within Urogyn sexual health medical needs. However, because of lack of reimbursement, which is the real reason why there hasn't been enough investment or innovation, there it just isn't enough solutions yet. So the areas of sexual health which do have solutions are the ones which do have reimbursement. And that is just how the healthcare innovation um, setup works, whether it's a big corporate or a small company. So what happens is, let's say, surgical solutions are covered by CMS, by the payers, then people will invest, whether it's a big company like GE or Medtronic or a small company with VC backing, they will invest and they'll create solutions. But if something, let's say, period pain, it's not covered by any reimbursement, then they wouldn't there wouldn't be enough backing financially to create solutions. Same with, say, dryness or prostate pain. So the challenge is, sorry, the challenge is if there isn't enough coverage, then the companies have to create the coverage, and that's the work, and that's part of the work we have done over the past 12 years. So then going into,
Sorry, I
sorry.
don't want to keep interrupting you. I hate this,
Mhm.
but we're seeing that jumping again, and it seems to happen when you change the slide. So if
Mhm.
you will take your slides down, I'm going to have Reagan share her
Okay,
screen,
yeah, sure,
see if that
sure.
will help, and you just let us know when you're
Mhm.
ready to
Yeah,
move the slides. So I'm sorry.
yeah, yeah, no, no, not a problem. Mhm. Yeah, perfect. Um, you can hear me still, okay? Okay, great. Yeah. Um, so, like I was saying earlier, so 12 years ago here at King's College, we started working on the solutions with the idea that if we can create at-home devices that patients can use, then we solve two major issues. One is the lack of, or the gap between how many doctors there are to how many patients there are, because then the patient can have the solution at home. And two is that the challenge, the stigma of a lot of people not wanting to talk to a doctor, not wanting to go out and tell them, I have an issue with my prostate, my erection, my vaginal dryness, and that. So those are the two big challenges. One is lack of doctors. One is lack of patients going to doctors. So how we worked on it is we connected with all the major urologists, OBGYNs, PTs across major hospitals, both in US and UK. And together we came up with what would be the a way they would solve it, the standard of care, and whether we could then recreate that with devices. So, for example, if the standard of care is using fingers to massage the pelvic floor, fingers to press the prostate, can we then use biomedical engineering to recreate those so the patients can almost replicate the in-clinic treatment at home with training and instructions. Um, then, of course, there was a lot of work on getting them regulated. So we currently are in 4 geographies: US with FDA, UK with CA, Europe with CE, and Australia with TGA. Um, but our biggest work has been in clinical studies. So we have published over now 23 papers, including in Nature. And the reason this is so important is there wasn't much work done in the use of vibration for specific conditions in urogyn health before we started. So the even the vibration as a therapy has existed for over 100 years, um, and it is very commonly used for other pain. Like there's a company called Theragun, which is used for back pain. So vibration as a therapy is very well established. The science behind it is very well established. There's a lot of clinical evidence, which is really great. But there wasn't any evidence within certain conditions. So, for example, vaginal dryness. And if we didn't do the clinical studies and publish them, then it would be very hard for us to convince doctors to give it to their patients, get feedback, and then eventually roll it out. So that was our, I would say, the longest piece of work over the last 12 years. Like one of the studies took 6 years to do. So now that we have enough evidence, we could get to the next step, which was reimbursement, which I will get to in a bit. Oh, sorry, next slide, please. Um, so what vibration does is actually really simple. So vibration stimulates blood flow and helps with block pain receptors. So it does two things. One is vibration helps with pain relief, which is anywhere in the body, whether it's vibration on the back, vibration on the prostate for prostate pain, on the pelvic for pelvic pain. And that's a very common thing, and it's very well established. And the second thing it does is it wherever vibration is applied, there is a very good influx of fresh oxygenated blood. And why that helps is fresh blood flow helps with sexual benefits like erection, uh, lubrication, pain relief, obviously, ejaculation. So, and all of that is typically 100 hertz frequency. And this is the research that has existed even before we started. So there was a lot of research already generally on vibration, which is why our professor, who's our chief medical officer, so he's been researching on it for 30 years. And using blood flow and nerve response with these targeted vibrations, we could address pain, dryness, erection, ejaculation, prostate, pelvic health, and a whole host of things. So if you go to the next slide, so this gives you an idea of some of our devices and why it does what it does. So for example, the first device, Crescendo, mimics 2 fingers, and it is designed by pelvic floor therapists to recreate what they would do if the patient came to the clinic. They would insert 2 fingers, reach the pain area, and massage those pain areas. And because that would not be possible for the patient to do to themselves, so this device is created so they can bend it and reach exactly where they need to deliver the vibration to recreate exactly what the therapist would do to have pain relief over, let's say, 3 times a week for 12 weeks. So going back to the, working with the doctors to recreate standard of care, this is a very simple example of trying to do something which, of course, ideally would be the patient going to the PT and doing it in person. But then the second best thing is them getting the training and doing it to themselves at home so they have access. And that is the biggest thing we are trying to solve, is to get access to healthcare, which they wouldn't otherwise. The the other example would be legato. Legato is designed by menopause specialists because a lot of the patients they see don't want to insert anything, but they want some kind of stimulation in order to create that blood flow, create that lubrication. So this was designed to bend and adapt to the labia externally in order to deliver vibrations without creating any insertion. And the other thing was the gap is big enough that the patient can keep it on and keep the vibration on to continuously generate the blood flow during intercourse. So that's another example. Then on the right-hand side, the shapes are again designed to do what is needed in terms of delivering the right vibration at the right point. So the underlying principle is all the same. It's 100 hertz frequency of vibration. The only difference between the devices is the shape, and that's it. So Tenuto 2 and Tenuto Mini, for example, they're designed to wrap around the penis, create the vibration, create the blood flow, and then it's very stretchy. So it stretches and then compresses to constrict the blood flow, but it doesn't constrict the bottom, which would otherwise constrict ejaculation and make it very painful. And it's designed in a way that it has the gap and leaves the gap, so it only constricts the blood flow to maintain the erection without constricting ejaculation or making it painful. And then the third device on the right-hand side on Molto, that is a very bendable device, and it's created exactly to mimic the index finger, which would be the standard of care. If somebody had enlarged prostate or prostate pain, they would go to a urologist, and the urologist would use the index finger to reach the prostate, press the prostate to release the secretions that are built up in the prostate. But again, that would be very hard to do, one, to access the time, but more importantly, to access the time many times, let's say, once a week for 6 or 8 weeks, which would be almost impossible to get from a urologist. So what happens in this case is they go once, they get trained, or they have a telehealth consultation, they get trained, they get the device, and they use it at home. And after, let's say, 6 or 8 weeks, then they have the next consultation, which is much easier to get. So again, very much what we are doing is recreating what doctors would do, then helping us develop these products in order for the doctors to offload some of their work to at-home care through devices instead of telling the patient, I can't see you for another 2 months, and that's it. So next slide. Access. So this is to me, after 12 years, uh, this is the most important work we do now. Because innovation is obviously important, and we continue to do more innovation. But if we don't make it easy for people to get these devices, it would be very hard to deliver the innovation to people's homes. So we spent a long time with the USVA, with a lot of the doctors at USVA. And last year, we got all our products, all the ones you saw, fully reimbursed, which means if any of you are a veteran, you can go to your VA center and ask them about it, and you can get it for free. And that's a very simple setup. So it's completely free, and as long as you're part of the VA system. The second thing we've done is all of our products are FSHSA eligible, which means that if you have FSHSA or HRA card, you can just buy it directly from our website, because our website is set up as a pharmacy at the checkout. So you don't need any letters, you don't need prescription, you don't need a letter of medical necessity. It's all completely automatic, just like going to CVS. So when you use your card, it will just go through. So we wanted to make it really simple for people to access. And the third thing we're doing, so we're now working on remote patient monitoring, because there is a CPT code which allows full reimbursement as long as the patient uses it. This is not rolled out yet. This is what we're working on now. What will happen is, let's say you go to a OBGYN or a urologist, and they give you the device. In that case, they will simply give you the device for free. And the only condition is you use it enough times. So they'll tell you how many times you have to use it in a month, and it will, in that case, right now it doesn't do that. In that case, it will send some information back to the clinic, um, which will just say how many times the device has been used, and then they will call you once a month to check how you're doing. And that's whole managed by the clinics and by the hospitals, not by us. So once we hand over the device to the healthcare provider, we are no longer involved. It's very much a patient-provider relationship. And then because they get reimbursed, the patient doesn't have to pay. So that's the final piece that we are working on, which would mean eventually everyone will get it for free, whether it's Medicare, Medicaid, or private payer, it doesn't matter. The codes already exist for remote patient monitoring. So that's but currently, if you're not a veteran, you would get it through our website using FSHSA if you have that. And we will create a code for the listeners anyway, so they can get it at cost price. Because our goal is ultimately that everyone can access it without having to spend any money, because that's the only way we can truly deliver the healthcare that we want. And we're now working with Kaiser Permanente as our first pair setup, where they will introduce these devices in the care pathways of 3 pilots. One is post-childbirth for pelvic pain, one is post-prostate cancer recovery, whether prostatectomy or chemotherapy, for erectile dysfunction. And the third one is for anyone who comes for a prostate exam to get the prostate health device, which if they use at home, one, it will alleviate their prostate pain, reduce enlarged prostate, and reduce the chances of cancer. And the background to that is the cost saving for a pair like Kaiser, in order to save costs at least 12 to 24 months down the line, for a very small cost of, let's say, $100, upfront. So next slide. And ultimately, we build everything with doctors, and all the doctors we work with are very evangelical. They are constantly creating videos so they can educate patients to use them, how to use them. They're telling other doctors. And that is the big piece of what we do. We're trying to constantly make people aware. Like veterans is a really good example where, yes, we are in the system, and that took 5 years to be in the system, in the procurement list, to be completely free. But there's a huge amount of work to do to educate 170 plus VA centers, where the doctors need to know that these devices exist. They're completely free. This is what they do. Anytime a patient comes who have any of these issues, whether it's erection issue, menopause issue, pelvic pain issue, they should just give them away for free. So that's really our big activity, for the next 10 years, is constantly educating people and then getting them to educate others. Yeah, I think that's it. Is that the last slide? Yeah. Okay, perfect.
Thank you. So we haven't received any questions yet, but I'm going to kick off a few. So first, I know you talked about, earlier in your presentation, if somebody doesn't have access to like an occupational therapist that does pelvic floor therapy, or addressing other sexual issues through their therapy, uh, do you typically have OTs that are starting to implement these devices in their therapy? Or are you seeing like an increase of them recommending this, maybe post-therapy? Because it sounds like you're starting to get it, into the United States. It's something that it sounds like you're developing lots of different partnerships, but may not be across the board. So, I guess that was my first question.
Mhm.
How's that
Yeah,
working with OTs?
so I would say that is the that's basically all our work right now is, so we now do maybe 30 conferences and exhibitions in urology, gynecology, menopause, pelvic floor, nurse practitioners, urogyn, everything you can think of. And that is the biggest, biggest work we do is going out there and educating people. Um, the only downside of being kind of alone in this industry, so like I was saying earlier, because of lack of reimbursement, there hasn't been much work in at home or patient care generally. Most of the work is in surgical care when it comes to sexual health. So we have to kind of educate on our own, which is not a great thing. It might look like, oh, great, there's no competitor, but actually having multiple companies doing similar things means they're all educating at the same time, so which is not the case for us. Um, once we educate people, once they come to know, then they start to try it. That's kind of the first step. They will take some devices from us, give it to the patients, get some feedback. Once they get really good feedback, then they get very excited. Then they tell other doctors about it, other therapists about it. They'll post about it. And then if they're allowed to, then they will resell through their clinic. And if not, like, so we work with lots of hospitals, they just recommend it, and then people buy it from the website. So, I mean, we've come a long way. So we started doing that around 5 years ago, the actual, because before that, we didn't have enough evidence and we can't really do much without the clinical publication. So we started getting some papers, say in 20, from 2019 to 2021. Then we started going out in 2021 and started building that up. And now we have quite a lot of hospitals, clinics who either sell or recommend our devices, apart from VA, of course. Sorry, there was a question. Hang on.
Yeah, and they wanted to know about ordering the devices and if they come in with instructions. And I'll add on to that.
Yeah.
Do you have any kind of support service to help someone once they receive a device if they have
Yes.
additional questions or need some help with the device?
Yes, yes. Two things, yeah. So we have a lot of instructions which are inside the box. We have lots of videos on the website, but also we have 24 hours in the working week. From Monday to Friday, we have 24 hours support. Either they can email us or we also have a phone number, so they can call us or email us if they have any questions on the devices, all the various things. The only thing we are not allowed to say is whether it will help with any medical condition, because the problem with us saying that is it may not be specific to that person. So, for example, if someone had surgery and then they say, oh, will it affect me? That's something we cannot answer. That has to be, and also it won't be safe for us to answer. So we would obviously be able to help with anything to do with the devices, how to use it, what are the biggest benefits. But we don't have any way of answering personalized medical questions.
So if someone is not accessing this through a provider, and they just go to the website and order directly, how do they
Correct.
know which devices to use if they have multiple issues? Because there is,
Mhm.
that chance that there might be multiple things people are trying to overcome.
Yes, I mean, that one is true, and that one has happened before. So we have a no questions asked refund or replacement policy, and because the challenge is it wouldn't work for everyone, and also they might have bought something that they think will work, and actually they need something else, and because it's Uruguayan, we can't do anything with the devices once it's been opened and used. So we just ask them to keep it, and then we either send them something different, which would be relevant, or we just refund them. Um, the I mean, we do have some kind of mapping that, for example, Tenuto 2 is if you have severe ED, so it's a much bigger device. But Tenuto Mini is if you have what's known as psychogenic mild ED. Yeah. And of course, Molto is very much for prostate. Or if someone wants like vaginal lubrication, and they don't want to insert anything big. Motu is very slim because obviously it's designed to reach the prostate, so it's very slim. So they might use that. Um, then the on the women's health side, crescendo is the one which is the longest, which means it can reach quite deep, especially with pain. Um, Poco is mainly used as a very small device for external stimulation. It's very easy to hold, easy to use. And legato is very specifically for whole labia stimulation. So it quite it's quite difficult to tell which one would work the best. Um, but what we try to do is have a lot of information. So like if you go to our product page, let me see if I can do that now. So just to give you an example, you'll see we try to put as much information as we can. Um, so if I share screen and you see this, yeah,
Yes, we see it.
yeah, you see it. So what we try to do is we have quite a lot of videos in order to explain the various things it does, what's in the box, what the instruction looks like. Um, and then, like you can zoom in and even read the instructions. I mean, it's very straightforward. It's designed, so that let's say someone in their 80s who's not very tech savvy would be able to understand it. It also, tells you what the dimensions are, so you know exactly how big or small it is. It has videos which explain how like it stretches. Um, so it shows you how to wear it on the penis. In this case, then you can, and these are all external videos. So these are all doctors who have explained how the device works. So you just click it and it will open their page. Yeah. So you can watch it there. Um, and obviously, they can go and read our publications, and then watch, like how to use the video, how to use or download the instructions. So we try to make it really, really detailed. So, let's say someone wants to read the papers, so they can go and read the studies, the summaries, the results, etc. Um, and then, there's a lot of questions to answer. So we try to, because it is quite hard to know, um, it is a new area. So we try to put in as much information, both visually with videos and of course, external other doctors talking about it, but also with lots of graphics and text. So I think once they go through the page, they will have an idea whether that's the right one.
Do you have any devices that address bladder dysfunction issues for women and urethral health, which can be very
So
much
we
tied to intimacy and
Yes.
sexual
So
health?
they're currently doing a study. So Albany Medical College, New York, is currently doing a randomized multi-center clinical trial on exactly that. But it won't be done till next year. So I mean, these things take a while. So yes, it might work, but we don't know yet. Um, and the product they're using is Poco, which is the same as Crescendo, just it is basically the pelvic pain device. They're trying to figure out whether vibration would strengthen the pelvic floor in order to address incontinence. So that's yeah, and because we are regulated by FDA, we can only say things that we have clinical evidence for and that we are approved for. So, but a doctor might say that. The doctor might say, try this device, it can help you. Um, so yeah, so it could.
And I know a lot of our audience are very interested in the clinical trial and your data. So I did drop a
Mhm.
link in case you missed it, everyone, to their page where they have all of their journal articles listed.
Yeah.
They have on their website, which it
Mhm.
also looks when you shared your screen that depending on which device you're on, it shows you the research for that particular device
Yeah,
too.
and there is a I'll send you the one um which has a lot of the studies in one place. So that one. Yeah. So you can like go to the actual publication. There's a link, and then you can read the full paper.
Fantastic. So for someone that's had their prostate removed and is experiencing temporary erectile dysfunction, would you recommend the Tenuous 2?
Two, yes, correct. So with the prostatectomy, typically what happens is nerve damage, and nerve damage can lead to severe ED. And with severe ED, the reason why 1002 is much better is because it creates stimulation on the perineum, which means it will create a lot more blood flow from the extra stimulation. And it does stimulate the penis as well, but stimulating the perineum and penis at the same time will lead to much more blood flow, which will lead to better erection. So is a study you will see in the list, which is exactly for that. There are two studies. One is post prostatectomy and one is post uh, chemotherapy. Yeah. Both for prostate cancer. So, and both with 10 and both had very significant um, IIEF, so erectile function score improvement with that. Um, Whereas 10 mini is very nice, very compact, but it's much more effective for psychogenic ED, which is physiologically everything is working fine. And a good way to know that is by having nocturnal erections. So if the penis has full erections at night, it means the arteries, the blood flow is all normal. And if there is erectile dysfunction, despite that, it typically is psychogenic, which means stress related. So that is much simpler to solve from a mechanical perspective with stimulation, which is why Tintamini is very useful there.
Fantastic. Well, I haven't seen any additional questions coming in. I don't know if there's anything else, any last points or maybe some frequently asked questions that's come up for you before that maybe we haven't asked you so far that you can think of to address
Um,
with everyone.
I mean, the thing is, what you will find is on our Instagram is quite popular with doctors. So on our Instagram page, you will see a lot of the doctor videos where they talk about lots of different things, lots of different ways the products are useful, how patients are benefited. That might be quite a nice way to figure out which device, if any, will be relevant. So I think that would be a good reference point. I'll just put it in here. Um,
I think that what we've heard from people before that unless they have been working with their physician, their movement disorder specialist,
mhm,
who has recommended a urologist and they have access to a urologist, a lot of these things aren't always addressed. And therefore, the physicians aren't aware that these devices
mhm.
are available, that they might be beneficial. Do you have any resources on your website that people can download that they can, once they've tried out the device and they say, hey, this has been really beneficial to me, but I want to share something with the physician? Would it be like maybe one of the articles or something like that that they can go
Yeah.
back and share that conversation? Because it's such a challenging conversation to have sometimes with the physicians when they're just focused on some of the other
Mhm.
main motor symptoms and not maybe something like this. This is a huge quality of life issue, but maybe under addressed.
Yeah, let me show you something. So this is what, and it is on our website as well. So again, to make it really easy for people to be able to use the devices at home, even if they didn't get a chance to meet specialists. We have documents like this, which are created by specialists. Um, can you read it? Like,
Yep, I can see it.
and so this is, for example, written by Dr. Nasseri, who's like a very senior PT who trains other PTs. She's at Rush, Chicago. And not only is it the text which says, this is what you should do, but also it has images which says, like very step by step, lie on your side with the knees bent, do this. So this is basically what they would do. This is how they would treat the patient, or this is how they would train the PT. So we have these in our support page. You can download these. And this is what you would get if you went to the doctor or therapist who has our devices or recommended devices. So our goal with all of these is to make it really easy for people, even if they didn't get a chance to see a specialist, to have these at home, use the device, follow the instructions, and even if they never get to talk to a specialist, still get help. So that's why we try to make it as simple as possible with visuals and like very step-by-step text.
Thank you. Sometimes we're in a position where we have to advocate and inform our healthcare providers because they just can't know all things all the time.
Correct.
So that would be a
Exactly.
helpful tool for folks.
Yeah.
Wonderful.
And the thing is, we're constantly on the road. We're meeting people, and we also get a lot of emails from doctors saying, "Hey, my patient told me about you." Um, you know, so you just anytime you see any doctors who are interested, just tell them to email us. Our email is our doctor email is medical@mv.health. Very simple. Um, so yeah, just tell them to email us. We'll either go and meet them in person or train them on Zoom and get them devices. So that's really our work is education.
So there was a question that came in. They want to know if you can clarify the VA process. This person is
Mhm.
a VA patient, but they live
Mhm.
far away from any medical center. How would they go about that?
I think they could get it from a community center because the community care gets funding from VA for looking after veterans. It's the same coverage, so they would then get it through the community care worker or clinician, as long as it's covered by the VA center's budget. So if they can't access the VA center, especially in rural areas, they would go to a community care who would have VA's budget, and they would get it. As long as they tell the doctor that, I know this device is covered, and can you write it down? And then the procurement would get it for them.
Okay. And I am not an expert on the whole VA system. So the person who asked that question, if you have any follow-up questions to that or comments, feel free to drop that in the chat.
Yeah,
But
just but you can also email us, the medical@mv.health. It goes to our head of sales who deals with all doctors, VA, everything.
awesome.
Mhm.
Sounds like you have a great support customer service available. And we've dropped quite a few links in the chat. So if you want to make sure you save your chat, that is links to, there's a discount code for you. So if you want to go on and find a device that might be beneficial to you, you can order it with a discount. There's also links to different pages, clinical trial information, videos, emails, all of the really important information. Make sure you capture that. And thank you, Reagan. She dropped instructions on how to do that. I don't know if all of you experience this, but Zoom is always updating and moving things around and changing how they are viewed.
Mhm.
So we have to constantly stay on top of those changes in life as well. I haven't seen any more questions come in, Soum, so I think you must have addressed everything thoroughly. I will still give everybody that last call. But I want to thank you so much for coming on and sharing this and for the work that you're doing at MV.Health. This is such an unmet need. So thank you so much for all of the research and development and obviously the work that you're trying to do to get this out there and available to people.
And thank you. Thank you so much for giving me more opportunities to share what we're doing, because that's really our work now, is telling people about solutions. The solutions exist more than they did 10 years ago, and making sure people can access them at the lowest price possible.
Which we all appreciate because we know how expensive everything is. So it's very appreciated. And so thank you so much. So I'm glad everyone that joined us today. And yes, it is recorded, so you can go back and review it. There will be slides available if you want to review the slides with the recording. But so thank you so much for coming and joining us all the way from London. So what time is it there right now?
Oh, it's 8 p.m., but I'm still on Arizona time. I was in Arizona till last night.
Okay.
So I am, I think, like at 1 p.m. in the afternoon in my head.
Your body is probably feeling all kinds of
Yeah.
crazy right now, but we appreciate you fitting us into your very busy schedule, especially with all your travel. And for everyone joining us today, we're so grateful that you joined us to learn about this. So thank you very much.
Thank you so much. Thank you, everyone.
Bye.
Bye bye.